Well, good evening and thanks for joining us here on Health Quest on News 20 on GTN. I'm joined now by Dr. Rob Elder. Glad you could join us here on the show, chiropractic physician, and I know a lot more, but we'll get into that in a minute. But it's been a while since you've been on. How are you?
Yes, it has. I've been wondering why you even called me. Feeling lonely, so I'm glad to be here.
Well, you know, it's really funny. I've got 3 kids of my own, and yeah, you hang out with other parents, and the number one complaint is always back pain. My back hurts because of the kids. My back hurts because I don't sleep right, because I picked the groceries up wrong. You hear this every day. Is this one of the biggest, I guess, medical problems in this country right now? Yeah,
it's also one of the most expensive because the way it's treated often isn't very effective. So people get chronic back issues and they're looking for more effective, cost-effective treatments, which is why chiropractic is so effective. They've done studies on that. We get really good results with patients with back pain because we're addressing the cause of it. So that's what it's all about.
And when I'll throw this right out at the beginning. You have people who will say, well, I'm not sure about chiropractors, what they do, what their purpose is in terms of working on my body. If I ask you that, and you had to tell everybody out there, how would you explain that?
The government did a study through the Agency for Healthcare Policy and Research. So they did a federal study on low back pain, and they looked at all the different providers that provide care for back pain. Orthopedic surgeons, chiropractic, acupuncture, massage therapy, physical therapy. They found that the patient satisfaction was the best with chiropractic, and we had the best outcomes. So that kind of speaks for itself.
So when you look at the chiropractic care, are you working on, is it the bones, is it the muscles, is it a combination, is it the disc? I mean, there's so many parts, and I think people just get lost. They don't understand what it is.
What I do is pretty detailed work. It's called chiropractic biophysics. So basically what I'm doing, because I practiced for about 5 years, and I saw the same patients coming in with the same problems, going, wait a minute, I just adjusted you, a month ago, and you're all screwed up again. What's going on here? So I got into some studies on my own. And so chiropractic biophysics, which is the most researched technique in the field of chiropractic, we're basically applying linear algebra, physics, and engineering to the spine. So we create this Cartesian coordinate system, the old XYZ axis. So we're looking at that spine. How does it compare to the normal model that has been developed through chiropractic biophysics? So when I have a patient come in, I'm analyzing that spine saying, how is your spine matching up to the ideal? And if it's not functioning correctly, we can identify why, and then we actually adjust them, give the patient exercises, teach them things to do at home to actually create changes. And I want to see that on post x-rays. We take pre and post x-rays to analyze their function.
When you, or if you had to maybe give an estimate in your thoughts, how many people out there actually have something wrong with them in terms of chiropractic, the way they stand, the way they move, the way they pick things up? Is it close to 100%?
Pretty close, yeah. I have seen one patient in my 23 years of practice that came in. He was the husband of a patient of mine, and he said, I just want to get checked. I feel great, I just want to get checked. I found nothing wrong. I'm like, that's very unusual, because everybody that comes in, they've got some kind of problem. Most of it, what the research shows, most of it stems from the neck. So when the neck loses its proper curvature on x-ray, it causes the low back issues because the body goes into compensatory changes.
Are these things that start off, Dr. Elder, when they are an infant and you're young, are they just bad techniques and they just get worse as you get older?
It's combinations. I mean, by the time a child goes into first grade, OSHA did a study that showed that children, like less than first grade, they've had 1,500 falls that can injure their spines. I mean, you've got kids. You see how many times they fall. They're constantly falling and running into things, and they bounce back up, but it causes microtraumas, we call it. Then we have car accidents and slips and falls and slipped in the ice and doing things at work and poor posture, etc., leads up to these biomechanical problems. You may not feel it at first, but eventually you will.
When you hurt your back, can you ever recover from that? If you have a broken bone, it mends, you're usually pretty good. But if you slip a disc or do something like that, are you ever 100% ready to go?
No, unfortunately, once you create that pathway of a disc herniation, which is where the disc actually tears, and then you get the nucleus inside, the jelly-like material kind of blobs out and it hits the cord of the nerves. You've created that pathway and it's permanent. However, you can stabilize it. And the key is to find out why that happened in the first place. What mechanically caused that disc to shear and blow out, if you will. So we're going to look at the mechanics and try to optimize that patient's biomechanical function so the problem won't return. And if it does, it'll minimize it.
When you talked about adjusting your spine or adjusting a person, what does that mean? It just, to me, it sounds painful.
Yeah. There's different kinds of chiropractic. There's the snap, crackle, pop, I think, which is
And I think that's what everybody thinks of.
Most people think that's what chiropractic is, and that's called diversified technique. I'd say probably 90% of the chiropractors do that technique. There's a time and a place for it. It works really well. It's called manipulation. I like to be very specific. I can't be as specific as I want with manipulation, so I use what's called an impulse adjuster and a drop table. So the table actually creates some of the force, so I can change the pelvic structure, let's say. The impulse adjuster looks like a little gun, and it impulses at a very specific frequency, which is tuned to the frequency of bone. It's got a computer in it. So I can take a contact on that vertebrae and actually create specific rotation in that vertebrae at a precise area to create the most change. So I'll analyze the spine, I'll say, here's what I need to adjust. L5 on the left, L2 on the right. I'm going to adjust T6, create more rotation here. And then basically it's like taking a stack of poker chips and some of the chips are out of whack, and we're going to put them back where they should be and let the body kind of unwind and fix itself.
When you hear all this, you talk about the cracking and adjusting, is it a dangerous thing?
No.
Or if you know as a chiropractor what you're doing?
Well, sure, yeah.
Like,
I would not let my, I would let your neighbor do it.
Well, you know what I mean.
Yeah,
yeah.
It just under the proper training, of course. We've had, I've had 9 years of schooling because you have to know when not to adjust as well. That's why I do a very thorough exam. My exam takes 25 minutes. So I'm doing orthopedic, neurological testing, x-rays to examine that patient very thoroughly, getting a complete history on them to see if this is a patient that's a candidate for chiropractic care. If they're not, I've got doctors that I work with that I can refer them out to. But yeah, actually there's been studies done on the safety of chiropractic. Our malpractice insurance is less than my car insurance. That's how safe it is.
The one thing we want to stress here on the show, as we do with all our health shows, is that we don't promote one doctor over another or one care agency over another, but what we try to teach people is that you need to investigate and take your time. Maybe go to 3 or 4 different doctors and find out which one suits you, because you will see a difference.
Sure. Yeah, you want to find the doctor that takes into account the whole person. So I do a lot of nutrition work as well, because I saw patients once again coming in with repeated problems, and I'm like, am I missing something here? And one of the things that I found was I wasn't addressing the nutritional component of that patient's health care as well as I wanted to. So if I got a patient that has nutritional deficiencies, they're never going to heal correctly in their spine. So I want to try to create as much of an environment for healing as I possibly can, addressing their diet, their nutrition, the chiropractic aspect. We actually have an acupuncturist on staff now. We incorporate massage therapy to really address that whole person. That's the best approach, really.
It's always said that your back and your core are kind of the main stable of your body, everything you do. Is that true?
Absolutely. And I teach patients about core work. So one of the first things we do is doing some very basic core exercises to create stability. And one of my mantras is, because you ought to see me brush my teeth, I'm doing some really weird things. So I'm standing on one leg and I'm tipping and I'm creating instability, which is going to create stability, if that makes sense. So the more unstable I can make my body has to compensate, and I'm going to get stronger. So I tell patients, stand on one leg when you brush your teeth, stick your leg out to the side like Karate Kid. Do these maneuvers that are going to help us create core strength for you. Then we get into the specific maneuvers based on their x-rays, their exams. So if they have a head shift to the right, I'm going to do exercises based on that postural alteration to create correction.
If you had to generalize everybody, just put everybody in one bowl, what's the biggest thing people do wrong? Is it the way they sit when they're driving the car because you spend so much time in the car? Is it
computer work, things like that? The most common posture pattern I see is forward head posture, which is this. There's something called torque. You've probably heard of torque. It's real big in cars. My car has 500 foot-pounds of torque. Well, torque is a measurement of force and distance. So your head weighs about 10 to 12 pounds, about the size of a bowling ball. And the body likes that over the feet, so nice and lined up. When you translate or shift the head forward, you're creating torque in the body. The body doesn't like this. It's very unstable. So what the body does is it actually rotates the pelvis. It twists the body to try to get those ears over those feet again. So that's the most common thing I see, and I tell patients, take your head, translate it back into your headrest in your car, and push, and hold 5 seconds. And then release for 5 seconds, and repeat that. Do that every day. That's a lifetime exercise.
So that's while you're driving, you push your head back?
Push your head back into the headrest.
So as I'm sitting here right now, or somebody's sitting on their couch watching right now, how do you even, exactly. How do you even know if your head is not pushed forward?
Most people don't know because they're unconscious about it. It's just, this is my new normal. And so when they come in the office, I actually bring these things to light and I show them their x-rays. We're like, oh my gosh, I had no idea. I mean, I've seen patients with their heads translated 3 inches forward. That's a tremendous amount of torque. So now we brought it to their conscious level, and so they can make conscious decisions. Oh, got to watch my head. So it's really, you want to get a trained assessment, and then we can actually give you advice on what to do to
Is that head leaning forward kind of the whole thing, keeping your back straight?
As far as like when you translate forward?
Yeah,
you'll go into
slump.
Yeah, your body will actually go backwards. So the rib cage goes backwards to compensate for that. So you get the dowager's hump. It's a big hump that people get when they get older.
Right.
That's totally preventable. That's from forward head posture not being addressed early enough. So you want to make sure you take care of that.
So you can, whether, I'm in my mid-40s now, can you always get better, no matter if you're in your 40s, 50s, 60s? Can you work?
I've never seen a patient that hasn't improved. Yeah, because you address different things. You want to hit fast twitch, slow twitch fibers. So we're going to do things like adjusting that patient. We're going to adjust that patient that's a fast twitch fiber. We're going to have them stretch over a device called a Denner roll or a Dakota traction wedge, developed basically to create stretching in the ligaments. That's slow twitch fibers. So you get a very predictable result.
Do you find most people will spend more time, we hear this all the time on all the shows we do, whether it's with a dentist or whoever, is that they'll spend more time trying to decide where they're going to go to dinner or where they're going to go on vacation than to stop and take time about themselves, about their health, about their future.
Yeah, absolutely. I think that we take our health for granted, but you got to look at the future. You know, I tell patients we're so in the now that we don't think about 5 years, 10 years from now. You know, what's going to happen if I don't change what I'm eating, how my posture is? You know, it's going to get better or worse. It's going to get worse. So we have to address those things.
You had mentioned as we started the show off a lot of different titles because you take a lot of classes and are very well versed in many different things. How have you seen your career change through the years as, you know, more developmental things like something we're going to see in a few minutes come on the market? Yeah,
I think that, as I said, as I've gone through my career in the 23 years I've been practicing, always trying to get better. I think that as a physician, it's my responsibility to a patient to make sure that I'm always on the cutting edge, if you will. And you hear that a lot, but it's true. I mean, that's my passion. I love studying. I'm one of those weird guys that likes to study and take courses. So I have a lot of different degrees and certifications. You know, it looks good on paper, but it gives me the clinical excellence to address that patient in a way that I couldn't before. So that's what I'm always looking for. What's the newer technology out there? What's the newer techniques out there that are going to help the patient get better? I'm actually training right now under another chiropractor who I think is a genius. And so I'm following what he's doing because he's an engineer by trade. And so he's applied this engineering model to the spine and has a computer program. So I actually send my x-rays off to him for analysis and I get a computer printout back that identifies bone by bone what's happening. So that gives me more tools, more information. I can adjust that patient more specifically.
Are there any two patients that are exactly the same? Or is
Nope.
everybody a little different?
Everybody's different. There's 1.4 million posture combinations possible in the spine. So yeah, there's a lot of differences there.
Now let's go ahead and talk a little bit about what you brought. If you want to grab it and pull it over in front of you and show us what this is.
Yeah,
I don't have any goggles on, so
this
don't
is very
point it at
expensive. Yes, yeah.
I'll tell you what. If you want to, if you can.
Kind of do like this?
Yeah, hold it up a little. There you go.
Is that good?
A little higher.
A little higher?
There you go.
Sure.
Beautiful. Now we can see it.
This is it's a K laser. The K laser is the best laser in the market. I've been wanting to get one of these for a while. I've been looking at the research on it. What this does is it creates what's called photobiomodulation. That's a big fancy term. And what it does is it drives oxygen into the tissues that are damaged, and it increases oxygenation in the cell. And there's this little thing inside each cell called the mitochondria. And the mitochondria, you may remember from biology class, it's the powerhouse of the cell that makes ATP. ATP is your energy source. It's like your gasoline that runs your body. So if we can drive more oxygen into that damaged cell and increase the mitochondrial production of ATP, we can actually increase healing. Speeds up the healing time. It's like Star Trek warp speed. So we're using this on pretty much every case that comes in the office because there's really nothing that this can't help.
So just looking at it now, does this, I guess, comes out on
this is the actual wand itself comes out, and this is a fiber optic cable, so I can unwind this. This is a program screen here, so I can choose what area that I want to treat. And then we actually go through a treatment regimen with a patient, depending on what the severity is of the case. We may do 5 treatments, we may do 15, it just depends on what we're dealing with.
And that allows you to isolate it down?
Exactly, so I can choose on here lumbar spine if somebody comes in with a herniated disc. So I can get in there and work on that disc with the laser, then we'll maybe do decompression therapy on them, which actually creates a vacuum phenomenon on the disc. I'll adjust them in mirror image, so we're doing lots of different things to correct the body from a biomechanical standpoint, biochemical standpoint.
So when you look at something like this, are you even amazed at how much can be done with something so little.
Yeah, people say that's not very big, and it's the smaller the device, the more expensive it becomes. It seems like. Yeah, these are awesome. This is how. If you ever wonder, like, how in the world did that athlete that just played in that NFL football game that twisted his ankle, he's back in the game in 3 days? This is how. This is what they're using. This is the newer technology. This is, to me, this is really the forefront of the technology today.
What do you see? I won't make you sit there and hold it the whole time.
Okay. Should I put it down here? I'll put it right here.
I don't want you to drop it and me be responsible
that would be bad,
for it.
yes.
Would be cool to wear the glasses maybe.
Yeah,
though.
here's the nifty glasses. The doctor gets the cool glasses. The patient gets the nerdy glasses. So
make sure, go ahead and hold those up. Let's get a close up.
Doctor cool glasses. Patient nerdy glasses, sorry. But if you're really nice to me, I'll let you wear the cool glasses.
Are you even amazed at how far things have come?
Absolutely.
In your time? What do you see for the next 5 or 10 years with chiropractic?
Well, one thing that we're looking at is, as far as diagnostic imaging goes, you're getting better MRI images because the magnets are getting much stronger. So when MRI came out, which helps us to diagnose a patient and create a correct prognosis for that patient, a correct treatment plan. So diagnosis is really where it's at. Magnets now are getting so big, they have to build the building around the MRI unit. So they actually build a platform, they lay the slab, put the MRI unit in, then they build the walls around it. That's how big these units are. But we can get such detail. There's actually 3-dimensional MRIs now, and I've seen them. They're amazing.
Is that dangerous for the consumer?
Not at all. Because
MRIs or is it becoming more safe?
Well, the MRIs are completely safe because MRIs are a magnet. There is no radiation. That's what's the beauty about taking MRIs. Now with X-ray imaging, there used to be dosage, considerations. That is really a moot point anymore because the X-ray technology, I've got a high frequency unit, it's all digital. I switched to digital about 5 years ago. So there is no more film. It all comes up on a computer screen. And it's like that. So I can actually alter that image if it's a little too dark, a little too light. I don't have to take another image. I can just alter the image quality. I can mark the images right on the screen. You get more damaging radiation being in a plane at 30,000 feet than an X-ray nowadays. So that's good news for everybody.
When you look at some of the technology right now and the way just medicine is advancing, you're seeing, I guess, do you see people with spine injuries being able to walk again, being able to move again?
Yeah, there's some new technology like with stem cell research, and that's a controversial topic. And so I have my own thoughts on the ethical nature of that, which we won't go into.
Right.
But stem cell research is very promising. There's these cells that are undifferentiated. You can actually inject them into the tissue, and it suddenly becomes part of the spinal cord.
Now, is that the only way that you would be able to, fix your spine? It's not like a broken bone where you can put it back together and you begin walking again. Yeah,
nerve tissue, when you damage it, unfortunately, it's usually permanent. But with these stem cells, because nerve tissue is differentiated tissue, it's that way forever and it will never change. Once you kill it off, it doesn't grow back. However, with these undifferentiated tissues, the stem cell, it actually becomes differentiated tissue. It becomes whatever you put it into. It almost sounds space age. It suddenly becomes a spinal nerve root. It suddenly becomes a liver. That's what they do.
What would you say to people out there who are interested in maybe doing what you do for a living?
Research the schools. There's chiropractic colleges all over. There's better ones than others. I won't name names, but if they have any questions, they can call me and I can direct them in the right path. But you want to look at the schools accreditation. They're all accredited by the U.S. Department of Education. And really find what your passion is. You got to have a passion for doing this. Don't get into it for the money. Don't get into it because you want a doctor behind, in front of your name. Get into it because you want to help people. That's the main driver. I actually go in and do guest lecturing at Logan Chiropractic College, and I get to talk to the students. Why'd you get into this? And it's kind of amazing how some of the students have never been adjusted, which kind of surprises me. It's like, well, what got you interested in chiropractic? Well, I just thought it was kind of cool. Well, for me, it was a life-changing event. I had a surgical procedure scheduled, and chiropractic saved me from surgery. And I'm like, I want to do this for a living. This is awesome. So, if they have questions, they can call me.
What about, are there different avenues you can take, like in communications, you can take television or radio or print or whatever. Are there different chiropractic segments?
There's certifications you can get in chiropractic. You can be let's say a DAC-bar. A DAC-bar is a diplomate of the American Chiropractic Board of Radiologists. There's board-certified neurologists. There's board-certified pediatricians in chiropractic. So we have these specialty niches that you can do if you so choose. I do a lot of personal injury work, so I have certifications in crash dynamics, auto accident reconstruction. I'm certified by the AMA to read MRIs. That's kind of my niche. And then the biophysics postural correction is really my passion. I like seeing people that are crooked coming in with problems and fixing. I've had patients come in with one adjustment. And she's like, I haven't slept in 10 years. It's the first time I slept it through the night. And that's a huge, win for me.
What's the youngest patient you've ever worked on?
In the hospital, just born. Yeah, the parents called and said, can you come check the baby? So I have taken care of like hour-old infants.
Now, what do you do with a baby like that?
Very carefully.
I was going to say,
yeah, well,
what are you looking for?
Yeah, I'm looking for subluxations in that spine. I'm looking for patterns in that spine. Is that spine functioning correctly? And I'll show the parents how to analyze the child so they can identify issues before it becomes a health problem. So we'll look at things like the gluteal fold. You put them in their tummy and squeeze their little butt cheeks together, and that gluteal fold should go right at the spine. If it deviates to the side, that means that sacrum has subluxated. You can take that child and analyze the atlas. It sounds kind of weird, but they actually take the child and hold them upside down by their little legs, and they should swing like a pendulum or hang like straight as an arrow. If they look like a banana, if they're curved, that means the atlas is shifted to that side. That's increased tone in that muscle. You can adjust that child, and it's a very gentle adjustment with the instrument or with a hand, and you can normalize that spine immediately. So it's really fascinating. And the kids love it. They sleep. You adjust a baby that's having problems, and they will sleep for hours. And the parents are like, thank you.
What about the other end of the spectrum? What's the oldest person you've worked on? 99, and then she moved. Yeah, she was amazing. I got an 86-year-old to take care of right now. He's a senior Olympic champion. He just got another gold medal. He does shot put, discus, weighted hammer throw, and javelin. It's amazing. I had another patient come in yesterday. He just set a world record on bench press for his age at 285 pounds. Wow.
And he's 56 years old. So he comes in for sports performance enhancement.
When you look at just the daily things that ache, like your back or your arm or your shoulder or your neck or whatever, you can't sleep, do a lot of these kind of maybe fall back into that spectrum of your back's causing this?
Well, it's either the back or the head. Let's be more, the head. When the head translates, once again, that's the driver. So when the head translates, the body's going to do this compensatory scoliotic changes. And so all of a sudden your shoulders start hurting. I'm getting pain up here in my shoulder blade. That's very common with women. That's because of the head posture. Low back with men because you've got this 10-pound bowling ball head translated out now. The body doesn't like that, so it's going to have to compensate. So you have to look at the whole structure. But when I'm looking at spine issues, I'm looking at the neck. I really analyze the neck very carefully. I take a front and a side view and a flexion extension view of the neck to see how each individual vertebrae is working. So I can analyze that, adjust it, teach the patient some exercises to do.
Somebody is worried like that, and you look and you're setting up a plan for them. Are you looking at 1 or 2 months, 6 months, a year, or is this
It depends on the case.
A lifetime? It
depends on, it's kind of like dentistry. I mean, you really need to take care of your spine for a lifetime. And a lot of people are like, well, once you go to a chiropractor, you go back forever. Well, if you understand the principles of why you go to a chiropractor, sure, you go back forever because you want to keep your nervous system functioning well, which runs everything else in your body. But depending on what that patient's goals are, if they come in with back pain, well, I've got to analyze why, and then we'll set up a course of treatment depending on what that patient's goals are. If they just want pain relief, I can do that. That may be 2-3 weeks of care. If somebody says, I want pain relief, but I want to really fix all that stuff on X-ray because that really scares me, which is what I specialize in, then that may be more lengthy. I'll usually do 20 sessions, re-X-ray them, and then analyze it at that point and see what we need to do at that point.
Once again, I want to touch on the whole aspect that we touched on a little bit ago about people spending more time deciding what they're going to have for dinner and what they're going to do for vacation than they do about their own health.
Right.
And this is something that could add 5, 10, 15, 20 quality years to your life. Actually, quality right where you're at right now.
And that's the key is not just, I don't necessarily want to live 100 years. I want to have a quality life. You know, my joke is I'm going to die underneath a barbell squatting at the gym, sliding into third, going for the win. But we want to look at quality of life. I mean, I see patients that are my age taking, 5, 6, 7 medications and chronic pain. It's just not necessary. So, yeah, we spend more money on our cars. We have no problems taking our car to get maintenance on it and spending $300 or $400 on the mechanic. But we kind of hesitate to spend money on our own health. We need to look at that and really see what our priorities are. Because if you're not healthy, you can't be a good dad or a mom for your kids or a good husband or wife because it affects your whole being. And so we want to make sure that we optimize our health as much as we can.
Do you size people up as you're just at the mall, at the grocery store, getting gas, whatever?
I'm like, look at that forehead. Oh my gosh, look at that head.
Do you ever say anything, or do you?
Sometimes I do because I'm very driven by what I do, and so I go up and say, you have any, did you hurt right up here? And they're like, yeah, how'd you know that? Because your head's out here, you know? I took a picture of a guy from the side just to show him how bad his head was. He's like, I had no idea. Because you can't see yourself from the side. So sometimes, I do weird things at the mall.
How should, if you're standing there and you can see yourself in the mirror from the back, or you have somebody take a picture of you, is your spine supposed to be straight down? Is it curved inward where your butt kind of, kind of slants out? I mean, what are you looking for?
So from the side view, the ear, the shoulder, the hip, the knee, and the ankle should be one straight line. And there should be normal curvatures to the side from the side. From the front, you should be straight up and down. And you should line up in the middle of the eye, here at the episternal notch, your belly button, and an imaginary point between your feet. So when I'm analyzing a patient, that's one of the things I look at is that analysis. How is her head in relation to the rib cage? Is it shifted? Is it tilted? Is it rotated? And then how's the rib cage to pelvis, pelvis to feet? So we can analyze that. And then that gives me ideas of how the x-ray should look. I kind of know what I'm going to see on x-ray before I take the x-rays based on that pattern.
Does stress cause any of these varying patterns with your neck and your back?
Yeah.
I know when I'm tense, like right now, I had a very tense day.
Yeah, you told me about that.
And, you know, my eye's been twitching all day.
Like, oh, this tick. Yeah, stress can lead to increased metabolism in the tissues. The muscles get tight, so now you don't get oxygenation in the tissues, and then the spine gets pulled out of normal position. So yeah, stress can lead to spinal issues.
What about exercise? We talked about nutrition a little bit, but what about exercise at any level, whether you're a beginner and you're just walking up to, you know, lifting all the time? Very good for you for a healthy lifestyle?
You got to be careful. The reason is because if you exercise the spine that's not functioning correctly, you're just going to ingrain deeper patterns. So if you have a big pelvic rotation causing a lot of twisting in the spine, I got a gal that's a runner, and she's quite a bit of pelvic rotation and a big rib cage shift. And I brought that to her attention, and I said, so now we're going to go out and run, so they're going to create problems. You want to exercise the spine into a mirror image pattern, and then as you progress and the spine gets more stable, then you can start doing more gym exercises. Go to the gym, have fun, don't push it though. That's the key. So get analyzed, find out what's wrong, and then I work with personal trainers quite a bit, and I'll say, hey, have them do this or this. So I'm a staff chiropractor at one of the local gyms in the area. And so they will send their clients into me. They say, I've taught them about posture. They got a big forward head shift. I'm really worried about doing exercises with them. You should be.
And as we wrap things up, Dr. Elder, if you had one thing to say to everybody out there, just something simple to the average person watching tonight who's probably on the couch, eating a little ice cream like I will be tonight afterwards, what would you say to them?
I think don't ignore your health. We can take it for granted, but eventually that will catch up with you. Our country has more people dying of cancer and diabetes and heart disease than ever. Even with the new technology, we've got to look at the basics, your diet, your nutrition, your spinal health, because that's where everything starts.
Dr. Rob Elder, thanks for your time. We appreciate it. Dr. Rob Elder, a chiropractic physician here in the St. Louis area. Thank you so much for joining us here on Health Quest tonight. Have a great evening. We'll see you tomorrow night.
I remember the moment.
I'll never forget that moment.
That moment?
It was a moment that changed my life. I'd been training with my team for months, and now we had been called up for the first time. The real deal. Wildfires were getting dangerously close to homes. At that moment, I got my first taste of just how important the Guard is to my community.
See how the Guard can be an important part of your life at NationalGuard.com.
Be out there. Be out there.
Be out there. Be out there.
Time was, kids did what came naturally. Spending free time running barefoot through the grass, wading knee-deep in streams, climbing to the tallest branch. But today, American kids are more likely found texting, watching TV, or gazing at a computer screen. They spend more than 7 hours in front of electronic media. Something essential has been lost. Childhood's connection to the natural world. That's why National Wildlife Federation created the Be Out There movement. Kids move indoors causes a host of problems, from obesity to ADHD. But outdoor play can go a long way to improving kids' health, body, mind, and spirit. It helps them stay fit, enhances creativity and attention spans, and could even make them better students. Do your part. Be a part of Be Out There. There's a reason why they call it the great outdoors. Learn more at beouthere.org.